The earliest visual acuity test would be blink reflex. Like when you show a flashlight, the child starts blinking its eyes. So that is the blink reflex. The next test would be fixing and following light. So you can see here this child, this can be done at various distance. The next will be the fixation pattern. If you see here the child on the left, you can see the corneal reflex which is seen very well in the center. Whereas the child on the left, you can see that the left eye is a little deviated, appears esotropic. PSM method, the central steady maintained, is a simple method to check the visual status. Usually done with one eye fixing an accommodative target held at 40 cm. The C refers to the location of the corneal right reflex. Normally it is in the center of the cornea and it's symmetrical. And S refers to steadiness of fixation. And M is referring to the maintenance of the fixation. So if the child is not able to maintain, that indicates a decreased visual acuity. This is just to be done, and this is a child here where you can see that when the left eye is patched, when you are offering her a chocolate, she is able to pick up. The same thing when the right eye is patched, is resisting occlusion. She is not able to pick up the chocolate and she is crying and she is trying to remove the patch. The Boy Candy test is a very simple test which can be done in the office to vision assessment by giving the small different size candies. It's also called as cake decoration, and the vision approximately corresponds to 624. The next test is the Lea gratings, is a preferential looking test, is the principle, and here the gratings of various frequencies are shown to the child. Simultaneously the plain placard side by side, and this can be done in children usually between 3 months to 1 year of age. The Taylor acuity calls a similar preferential looking test where you have black stripes of varying thickness, and this is how the test is done. The examiner sits behind, there's a small hole, and observes the patient's face and the movement of the eye. For older children, where the child is asked to match the symbol shown at distance with the symbols given in the card child's hand. This is usually meant for preschool and kindergarten age, and they have different shapes which will attract the child. The shade
are they equal? Are they normal looking? Is one eye smaller or bigger? Then we check the lacrimal sac. Usually children who have lacrimal sac problem will get discharge, watering from the eyes, but you can check for it by gently pressing the inner corner between the lids and the nose as shown in this video, and look out if there is any pus or mucus coming out from the underlying lacrimal sac around the eye. If there is any difference in the appearance of the eye, or there is defect in the eyelids or swelling around the eyes, or any discharge, redness, transparency of the cornea is lost, or the clarity of anterior chamber is not there, or the shape and color of the iris or pupil, then these are abnormal. Normal red glow, which you also sometimes see in bad photographs, that a red color comes in the eye, the red eye. If there are abnormalities of this red glow, then it may look white, which is called leukocoria, or yellow, or no glow. If the glow is different in two eyes, that is also abnormal. In such a case, the pediatric eye specialist or the special eye specialist should be consulted at the very earliest, because these are serious. Should also undergo eye examination, because many times the eye is involved in these diseases, and also the eye can provide the clue to the diagnosis. Those babies where there is a family history of the parents, siblings, first cousins, or other close relatives like uncles who have had eye problem in childhood or young adulthood, they should undergo a very detailed eye screening. And in fact, if the elder child had an eye problem, then it is better for the parents to have more detailed discussion with the doctors even before they become pregnant next time, or during the pregnancy, rather than waiting for the newborn child to have the disease. Now, infants who are sick, that means they were admitted in hospital with infections like HIV, like some eruption, viral infection, rubella, septicemia. If they had IV line, that is saline, for more than 2 weeks, then they are at risk of developing infection inside the eye. Which the last but not the least, the babies who are not having eye contact or don't follow an object as you see in the video, or have an abnormal eye movement, that is the eyes are moving up and down, or they are shaking, or they are looking sideways after 6 weeks of birth. And those children whose mothers complain that something is wrong with the eye of my baby, these babies must have detailed eye screening done, including fundoscopy.